nearly $50 million billed for puberty blockers using a vague code.
I'm Admiral Brian Christine, your Assistant Secretary for Health, and I'm here with CMS Administrator Dr. Oz. The Department of Health and Human Services recently released the report Wolves in White Coats, identifying some deeply concerning trends. A structure of incentives encouraging hospitals and providers across the nation to conduct sex-rejecting procedures on minors with gender dysphoria. The report includes 8 heartbreaking and shocking testimonies from patients and parents whose experiences put a human face on these findings. Their stories describe vulnerable young people struggling with trauma, with mental health challenges, and discomfort with their developing bodies, only to be placed on paths toward life-altering medical interventions. I'm talking about castrating chemicals and mutilating surgeries. More than 225 hospitals and health systems nationwide develop pediatric gender programs. Now, no child or their family should ever have to wonder whether the medical establishment they trust is working for them or working against them. As physicians, we have to ask the difficult questions before subjecting a child to invasive, sex-rejecting procedures, especially when the potential consequences can follow that child for the rest of his or her life.
Adolescence. It's a time of real change and uncertainty. It's a time when young people deserve the kind of care where clinicians can look them in the eyes, ask the deeper questions needed to heal, and empower them to find peace in their own bodies, free from invasive procedures before their frontal lobes have fully developed. That doesn't happen until the early 20s. But over the past decade, there's been a massive uptick in billing for sex-rejecting procedures in hundreds of hospitals and health systems all across America. We found nearly $120 million in bill charges for these procedures on minors just between 2019 and 23, including over 5,500 surgeries and 8,500 courses of hormones or puberty blockers. Now, CMS has a duty to make sure taxpayer dollars are spent lawfully, so we looked closely at how these procedures were being billed. Our nationwide analysis found nearly $50 million billed for puberty blockers using a vague code, endocrine disorder unspecified, instead of a diagnosis that matches the treatment. Now, when the code on the bill doesn't match the care being given, that's a red flag worth investigating. The data points to a scheme behind it, and it's driven by greed, not care.
When insurance wouldn't cover a sex-rejecting procedure diagnosis outright, these clinics used a broader, more accepted code. And this is all part of a deeper structural problem identified by our report. Hospitals have been establishing entire pediatric gender programs around a model of long-term recurring care. Lab draws, hormone refills, follow-up visits for years and sometimes decades to create what we call captive patients. The system stands to reap $25,000 to almost $200,000 over a patient's lifetime, all from a physically healthy child. To get to the bottom of it, Vice President Vance and Secretary Kennedy have referred these findings to the Department of Justice and our own HHS Office of the Inspector General for further review.
When billing practices obscure what care was actually provided, especially when children are involved, we have an obligation to follow the facts. We will protect the integrity of our programs, demand accountability, and make sure the American people are not footing the bill for sex-rejecting procedures that inflict irreversible harm on young patients. Patients should never have to wonder whether the institutions they trust are putting ideology ahead of the child's well-being.